Hello, this is a PowerPoint presentation for the University of Texas at Arlington Nursing Course 5382 in Healthcare Policy. This PowerPoint presentation discusses the BSN 2020 Program Initiative. It is presented by Katie Bartlett, Carrie Davis, Kenesha Houston, Donna Lynn, and Marcia Thomas. There are numerous programs across the nation, but there is no standardization of the content and the curriculum. When an RN with an associate's degree or diploma decides to pursue furthering their degree, they have many choices. These authors point out the important thing is to find a quality program that fits the needs of the nurse and chooses the one that fits their needs, whether that means more face-to-face time with instructors and fellow students, or whether that means online courses that fit a busy work and home life. Also to be considered is the flexibility of the program and whether the classes are scheduled on a traditional college schedule or whether on an abbreviated schedule. In choosing the program, the nurse must take into consideration the prerequisite courses required before application can be made, or whether the program incorporates these courses. It is also pointed out that a problem involving prerequisite courses is that an associate and diploma degree generally require degree-specific prerequisite courses, while RN to BSN programs will require the same type of general prerequisite courses as other baccalaureate degrees such as English, social sciences, and liberal arts classes. It should also be noted when researching programs that some university programs no longer offer RN to BSN programs but do offer an alternative entry RN to MSN program. These programs require the nurse to complete the BSN requirements while working on their MSN. Cost also varies widely from program to program depending on whether the program is located in a public university, private university setting, or a proprietary school. These will also influence the choice of programs. Patient outcomes. According to American Association of Colleges of Nursing, or AACN, research has shown that positive patient outcomes have been associated with the number of BSN prepared nurses. Patient outcomes such as lower mortality rates, fewer medication errors, decrease in deaths and complications, decrease in decubitus ulcers, decrease in post-op DVTs, reduced pulmonary emboli, shorter length of stays, and reduced CHF mortality have all shown to have great impact by the education level of the nurse. The AACN is committed to working towards creating a more highly qualified nursing workforce as they believe education improves competency and care delivery. Robert Wood Johnson Foundation pointed out similar positive correlations between patient outcomes and the education level of the nurse in their research studies. Patient outcomes such as decrease in patient deaths, decline in mortality, shorter periods in the hospital, and lower healthcare costs were noted. They concluded that hiring more BSN nurses is enough to improve patient outcomes. Percentage of registered nurses by degree. In the year 1980, registered nurses varied greatly. BSN nurses were at 22%, diploma nurses had the highest amount at 55%, associate degree nurses were at 18%, and doctoral and master's prepared nurses were at 13.2%. Now fast forward to the year 2008, BSN nurses increased to 36.8%, and diploma nurses dropped significantly from 55% to 13.9%. The amount of associate degree nurses jumped up from 18% to 36.1%, and doctoral and master's degree prepared nurses stayed the same at 13.2%. In the year 2010, 22,531 nurses with associates or diplomas graduated from baccalaureate programs. So there have been great strides made recently in these bridge programs that better prepare the nurses to meet the demanding needs of our patients. The future of nursing. In 2008, the Robert Johnson Foundation and the Institute of Medicine began a 2-year investigation to evaluate the state of nursing and offer recommendations for improvement. Several themes in the published report focus specifically on nursing education. Nurses should practice at the full extent of their education and training. Nurses should achieve higher levels of education and training through improved educational systems. The report recommends increasing the proportion of BSN prepared nurses to 80% and doubling the number of doctoral prepared nurses by 2020. The increase in baccalaureate-prepared nurses is necessary to ensure that the right nurse is equipped with the right training to handle the complex patient care needs in the 21st century. Baccalaureate and advanced practice nurses are needed as healthcare transitions to providing care in community settings. Texas offers many programs that offer online courses and online degrees. Some examples of these universities are University of Texas at Arlington, University of Texas at Tyler, Texas Tech University, Texas Women University, Texas Christian University, and West Texas A&M. This is not an all-inclusive list, but these are a few examples of universities that offer online nursing programs. As mentioned before, not everyone enjoys online learning, and some do better in a face-to-face traditional class setting. But there are some advantages found to an online course. For example, it's self-paced. You can fit in the requirements of the course within the time that you have, whether it's after work or at work or between children or between families and other demanding needs of your life. You can fit it in where it fits best for you. Many of the nurses have the ability to continue to work full-time, and so they don't take a decrease in pay or decrease their working hours or their benefits in order to go to school. Many of these programs have part-time and full-time options. There is a cost savings in some of these programs. Many times because the volume is higher, the cost of the degree is not as much as if you were in a traditional setting. There is also the ease of accessibility. You can basically take these courses anywhere you have an internet connection. You can take them from the ease of your home, from a coffee shop, from the library, if you have time on your lunch break at your place of employment. There's many options you have as to where you can take these courses. One of the huge advantages is there's less travel time, and if you live in a metropolitan area, everyone knows how terrible traffic can be, or if you live out in a rural community and are having to commute in to receive the education, there's no travel time that are associated with this. You can basically take the courses from wherever you have an internet connection, and you don't have to drive to the university to sit down and take the course. This last slide is our reference slide. It just is an all-inclusive list of where we received our knowledge and our research, and of where we found the ideas and research promoting the necessity of BSN prepared nurses. I hope this presentation has helped you gain a better understanding of the importance of being a BSN prepared nurse as opposed to a diploma or an associate degree nurse, as it increases our patient outcomes. Thank you.